Okay. Congratulations, Matt. That is awesome that you're off um, the Lexapro. Love this. So happy that you were able to come off. How can we stop psychiatry medical frauds? I think, I mean, we have to keep on talking about it. It's to me, I've been in the space for a while, that it's the most obvious fraud that I've seen in medicine, and it's just ripe to be bust open. I feel like it's happening right now as we speak. I see more and more people talking about it. I see media on the left and right talking about it. So I think making noise, talking about it publicly, and talking about it to people that you know as well. Let's see. Any thoughts on using psychiatric drugs as a way to help with neurocognitive issues that look like psychiatric issues? I would be really hesitant about this. The longer that I've been doing this more, the longer I think that I think it's a little, I'd say, hubristic, or to think that we could introduce a drug into the brain and help with cognition. I think it's so sensitive. And I know some people think that ADHD medications really help in that way, but the data that I've been looking at shows that the ADHD meds aren't even really improving outcomes. So in terms of fixing cognition, I think one of the best things you can do is to get your diet right, especially if you're consuming too many carbs. I know that they're calling Alzheimer's type 3 diabetes now, so insulin resistance is a big part of that. And so I would go with healthy eating. Okay. Oh, with a head injury. Yep. So Jennifer, with a head injury, I would say time is what's going to help with a head injury, and also putting your body in the best place to heal. So good diet, move your body, all of that stuff. Okay. Let's see. Guys, we've got lots of questions coming in. Forgive me if I missed some of them. Okay, let's see. What's my opinion on Suboxone? Do I think it's safe? Yeah, so for the people listening who may not be aware, Suboxone is a drug that's used for opiate use disorder, and for people coming off. And so my answer is yes. I actually think that's a fairly safe medication. I see it no more dangerous than opiates. In fact, it's safer if the opiates, if you're getting opiates from the street, where it could be cut with fentanyl and things like that. What I want people to think about, when they're coming off opiates and anything that they're addicted to, is that it is much more than just replacing, say, the heroin or the pain pills that you're getting from your doctor with just something else that like Suboxone. Usually, people who end up having problems with these things are having really legitimate problems in their life. And sometimes it's even spiritual problems. And that's why AA, even if you're secular, even AA has a lot of good Christian values in there, and kind of universal values from religion, which can be really helpful. And so anyway, the summary is, don't just rely on a medication for any addiction type issue. You have to go deeper. Well, 2 days without gabapentin, that's a hell of a withdrawal, especially if you're on 2300, which is near the max dose of this medication. So I would, not stop that medication cold turkey. That'll definitely make you feel depressed. So, how can I fight off doctors who want me to take statins, and can it increase my risk for Alzheimer's and dementia? Okay, so let's separate these two things. So Alzheimer's is a progressive dementing disorder. I think it has a lot to do with what we eat, honestly. And so the best thing that you can do for Alzheimer's, I think, is um, a good nutrition, particularly glucose control. Um, Statins, now what statins are doing is they're causing cognitive impairment for some people. So, but that should be reversible when you stop the drug. As for how do you fight off the doctors who want to put you on statins, like I I think statins are, I mean, unless you've had, from my understanding, unless you've had a heart attack or something close to a heart attack, there's no survival benefit with statins. I know they try and pressure people onto them, um, but that's not to say don't take statins and do nothing. Look at your diet, look at saturated fat intake, and see if you can bring it down with non-drug means. Okay, let's see what else we got. Is supplements safe to take during a benzo taper? Let's see. Some people say yes, and some people say no. So my thinking on supplements is that they kind of fall into two categories. One group can like people. Sometimes people take supplements to correct imbalances. Like if you have low B12, low folate, low vitamin D, um, um, you want to take a supplement just to get back to normal levels. But then there's a whole nother group that, I mean, supplements are also done almost in a way like they're pharmaceuticals, and they call them nutraceuticals. And so this is things like St. John's wort, ashwagandha, lion's mane, mushrooms. Sometimes like very large amounts of magnesium can be used in this way as well. And so they're using, quote unquote supplements, but they're using them almost as pharmaceuticals because they have a drug effect. Generally, I am not a big fan of using anything, a pharmaceutical or a non-pharmaceutical to kind of calm you down, help you sleep, do anything like that, because I think the same principles of tolerance apply, and eventually it wears off, and it can cause problems. But using supplements to fix actual deficits that you're having, I think that is great, and I think you should do that. My husband was in treatment for stress and depression. He got verbally abused by his provider and had a panic attack. What can I do to help him? Breathe. Just breathe. Be with him. Acknowledge what's happened, and do some deep breaths. That's an awful experience, and something that no one should experience when they're going to a provider for help. I'm really sorry that happened. Okay. How can we tackle the PTSD that comes from protracted withdrawal? For the people that don't know what protracted withdrawal is, it's essentially almost like a concussion type injury that happens when you come off antidepressants and benzodiazepines too quickly. And I mean, there is some serious trauma that can happen. I know of some people who, when they get through protracted withdrawal, because they've spent so much time in their bedroom, they end up getting triggered when they go into their room or when they lay in their bed because it's associated with pain. The one thing that I would just say is you are strong, and you will make it through this, and to just keep on going and keep on living your life and working through that trauma. But it can take time, and give yourself a lot of grace. And you will go back to living a normal life. It can just take some time. And so I work with lots of people who have had horrible trauma from protracted withdrawal. They go back to living normal lives. Don't let it hang over your life like a cloud. And try and live as normal of a life as you can while you're recovering from this, or you've recovered from it. And I think that will lead to the best outcomes. Okay. Okay, technical question here. Okay. I'm worried about coming off mirtazapine. My pharmacist has read the Maudsley deprescribing guidelines. How do I handle symptoms with lower dosing? So let's have a think about that. If you're doing tapering correctly, if you start to have symptoms, you should go up on the dose. I really love it when people use liquids, and let's just say, you liquefied 15 milligrams into 1 ml, and you notice that when you went from zero point 0.5 to zero point 0.4, oh, withdrawal symptoms. Don't hang out there. Just go back up to 0.5, and the next time, just do a smaller reduction. Um, when you're coming off these medications, if you have an intact nervous system that hasn't been kind of hurt by the withdrawal, it should normalize pretty quickly. And as you come off the medication, you should never really be in a situation where you're having severe uncontrolled withdrawal symptoms. And so the solution to handling withdrawal once you get lower is to just go slower, and to just know that that is totally normal to go slower. All right. I went through painful protracted withdrawal for years. I healed from the worst symptoms, but have PSSD. What advice do you have for PSSD healing and recovery? So, uh, the advice that I have for this is that I have heard from some people that they get better, but I also know some people and they're sick for a really long time. Um, PSSD, I would treat like any kind of chronic illness. There's a really good book called How to Be Sick, which is about really acceptance of a chronic health condition. Because if the PSSD is going to get better, it's really neurological healing, right? That will take place over time. And so, how do you live the best life that you can while you have PSSD, which really is like, how can I live the most normal life? How can I, give back to others? How can I, share? How can I be helpful in this world? How can I live a normal life? And so that would be my advice to someone with PSSD. Find a way to give back to others, find a way to be engaged with your family and your loved ones, and try and live as normal of a life as possible, while you wait for that healing to happen. And Eli, I am going to pray that that healing happens for you. Do you ever get patients with dysautonomia who are prescribed SSRIs, struggling with the damage done to them? Should I collab with Dr. Nate Kaiser? I don't know who Dr. Nate Kaiser is, but dysautonomia is a really common symptom from, the moderate to severe protracted injuries. For people who don't know what that is, it's like you can get like swelling in your legs. You can get a heart that beats erratically. Sometimes when you're just sitting in a chair, it'll just, you'll have heart rate up to 160, 170. You can have blood pressure problems. And for sometimes this just happens independently, but we see it a lot with withdrawal problems. And it's a sign of global neurological dysfunction. It's usually happening along with the severe anxiety, the brain fog, sometimes the ear ringing as well. What I will say is that is a symptom that goes away along with the other ones. People are always just like, well, I have this symptom. This means it's really bad and it's not going to go away. Whatever the constellation is, I've probably worked with nearly 300 people with antidepressant withdrawal injuries now. It's not like there's ever this one symptom that doesn't go away. They all seem to gradually go away in time. And so, yes, by all means, go see the doctor for dysautonomia. Be careful with medications if they want to prescribe them, but you can also have faith that the healing will happen. And that's not a blind faith. That's also empirical. Me and most other experts that work in this space, we see most people healing, usually within a couple of years, but still after that. And so if I was a betting man, I would strongly bet that dysautonomia will recover as your nervous system continues to heal. My daughter's on 2 milligrams of Klonopin a day and can't get off them. I'm scared for her. She's got agoraphobia. What should she do? So the problem is that Klonopin can actually cause agoraphobia, which can make things really challenging. Many people don't realize that like Xanax, Klonopin, Valium, diazepam, over time, they will make anxiety worse for many people. And agoraphobia is really common. Another really common symptom is obsessive thoughts. If someone didn't have them before, they start to experience those. Intrusive thoughts as well. And so if that's going on, I would just say raising awareness to her that the drug actually might be making her worse. And, now she's agoraphobic, community ties and relationships break down. The hard thing is, though, is with getting people off psychiatric and even any other drug, the first thing that you need to do is get them on board. Unless they are bought in to the process, it can be really, really hard. And sometimes sometimes there needs to be a lot of pain for that, for them to realize, hey, taking more and more of these medications really isn't helping. Yeah. Thoughts on Agomelatine, no withdrawal, sexual dysfunction. Why isn't it widely used? This must be a European medication, because it's not something that I am familiar with. Um, I'm not sure why it's not more widely used. I think we should try and get in touch with Mark Horowitz and ask him about that one. Um, the cynical side of me says that if it doesn't have any withdrawal, then it's not dependence forming, and then drug companies aren't going to be as interested in a drug like that for customers. Although they would never say that, but when I hear something like that, I'm like, oh, that's bad for sales. Yeah. Oh, Jesus, this is a tough one. How do I get off these meds? I'm court ordered to, when all I did was be open with everyone in my community about God and Jesus, with me getting death threats and jumped while heading home. I think you need to empathize with the concern from the other people. What was it about your behavior that led to, I guess, your family or whoever it was getting you on a court order? So empathizing with the people who are concerned about you, and just time. I mean, eventually you're going to want your family to be the people who are going to advocate to the judge to remove the court order for the medications. And so I know, listen, I don't know your situation. I imagine I could be really frustrated and let down with my family. Try your best to reconcile with them and see things from their perspective and rebuild that relationship. Yeah, visual disturbances can happen. They're not as common they're not as common a part of withdrawal, but some people will develop a condition called visual snow. I have an interview on my YouTube channel with a gentleman on trazodone who developed that. And so yes, the antidepressants can cause visual snow and other visual disorders. I don't really know what nefazodone is. I think, where did this come from? Oh, this is a bad drug. This is the one that causes severe liver damage in the US. So no, stay away from nefazodone. I don't think it's better than benzos or SSRIs. How long will it take to come off 50 of Zoloft? The question is, how long have you been on it? If you've been on it for less than 3 months, you should probably be able to get off in about 3 months. If you've been on it for decades or multiple years, most people I see coming off in 1 to 2 years who are sensitive to withdrawal. There are some people who can move faster. I think we all know, well, you may not, but I know a lot of people who have been able to come off in 2 months. I think it's massively risky to do it. And so I recommend that everyone should just taper off at a rate that their body tolerates. And if it's been multiple years, I'd look at this over a course of a year. Don't rush to come off these medications. Just do it gradually, and try not to make a big deal about it. Hey, Magdalena. Patients from Canada, any thoughts on tapering clomipramine? Um, Clomipramine, I would say, is kind of like tapering an SSRI. It's very serotonergic. It's one of the strongest serotonergic tricyclic antidepressants. Um, and so I would say it's a high risk drug to taper, just like any of the SSRIs. And I think liquefying it, especially when you get to the lower doses, is probably what I would do with my doc if I was you. Um, in general, I actually think, TCAs, maybe they are a little safer than SSRIs. I see less drug injuries with those. So, but yeah, I would liquefy it at a low dose. And I don't work in Canada, unfortunately. I wish I did. Good luck. Okay. What are your thoughts on mixing antipsychotic medications with stimulants? Do you advise against this? This is insanity to me, honestly, because for a couple reasons. The first reason is it's like pressing the gas and the brake at the same time. Antipsychotics, they block dopamine. Stimulants boost dopamine up. And so if you're having like brain fog, you might just be on too much antipsychotic. Just ease off the antipsychotic. The other issue is, if you have a psychotic condition like bipolar or schizophrenia and you're taking a stimulant, that can also precipitate psychosis. I would lose the stimulant and then see if you really needed the antipsychotic. Best way to get off antipsychotics if you have schizophrenia and bipolar disorder is find someone who can help you do a ketogenic diet. That's been one of the most consistent ways that I've seen some people be able to get off. Yes, Nolan. This is not based on any research. It's just based on people who walk through my door, my virtual door at the taper clinic. I'm seeing lots of SSRI problems, rarely tricyclic problems. They're less common, but I think I should have seen some of them already. So I do think my gut feeling is they're safer. They're messier drugs as well. The SSRIs were designed to just like hammer that receptor. Tricyclics, people, they act on multiple receptor systems, and so they may not cause as severe kind of changes to the brain over time, just because they're not hitting individual receptors in quite as a targeted way as the SSRIs. Yeah, this is a toughie. Best way to taper off Zopiclone. So this is a Z drug, one of these really short-acting drugs that can lead to sleepwalking and sleep sex and sleep eating and all of that stuff. I would say go to Valium. Search for the Valium conversion and get over onto Valium and then taper off the Valium. That's typically what I do with Ambien and Zopiclone. No, I wouldn't say so. I mean, it depends on the training from the person. So bind is benzodiazepine-induced neurological disorder. Generally, this is something that happens after chronic long-term benzo use, although it can happen in a shorter period of time. Sometimes bind happens when people rapidly stop benzodiazepines. And the way you diagnose bind is two things. You need to look for neurological problems. So usually people are looking at like Parkinson's, Huntington's, multiple sclerosis, just other explanations for like total, neurological dysfunction. If they've ruled those out, then the symptoms of bind is how you make the diagnosis. So generally, severe anxiety, cognitive impairment, ear ringing, brain fog, neuropathy in your hands and feet. I see that sometimes. And just gradual appearance over many months to years of benzo use, not getting better with higher doses, and high sensitivity to withdrawal because the nervous system gets so sensitized. When you develop bind, it's really hard for people to come off. And so that's kind of the clinical picture. I don't know any neurologists who have training into this. That's a really specialized area. So I would be doubtful that the neurologist would be able to make that diagnosis unless they're interested in this. Yeah, nothing wrong with Clorazepate. It's less common benzo, super long acting. It used to be used a lot more. If it's working for you, don't worry about it. It's quite a fine benzo to taper off. Get your family medicine doctor some medical research articles on bind. Go to Google Scholar and search benzodiazepine-induced neurological dysfunction. Print out one of the papers next time you see them. Bring it to your doctor and say, hey, could you please put this in my chart along with, these notes, and maybe you just give him 5 bullet points. How do you get off Effexor? I would transition over to the instant release version of it and then do a liquid taper of the instant release version. Most people nowadays get it in the extended release with the caps and the beads. Oh, actually, that's another way you could do it. If you open your cap and there's beads inside there, you can remove the beads gradually as well. Yeah, B12 deficiencies and D3, low D3. I mean, these are common, like nutritional deficiencies. The D3 is low because we spend all our time inside. The B12 is low because Americans, and I think probably a lot of other people, are really not eating enough leafy greens. Your broccoli, kale, spinach, things like that. And so, yeah, if you need to take supplementation, do that. Otherwise, just increase leafy greens and get in the sun. Do I know of tofranol? Yeah, I would say it probably was more common back then because 1994 was just when like Prozac and the other SSRIs entered the market. So most people were still using those older antidepressants. So that doesn't surprise me. Hey, Brandon. Good to see you on the stream. You sent me some stuff a while ago, and I looked at your videos, and I'm so happy that you're here and you're on this stream and you're asking questions because I know you've been through really, really bad akathisia. So great to have you here. Where can you go to get help tapering online? There's a video on my YouTube channel called How to Find Help, and it goes how to find help for withdrawal, and it's everything from like finding coaches, free resources. I think the Inner Compass place is a free resource. If you join my mailing list as well, just on the Taper Clinic website, we have a free tapering guideline as well. You just put your email in. It's the first thing that we send you. And it goes through how to taper. But otherwise, that video on how to find help is a good place to go. Yeah. It's not a question, but thank you, Brittany, for the support. We are having a very special moment right now. And there's more coming. There's going to be a lot of national media appearances, actually, for us. Ever since we did the Tucker Carlson show, we've had a lot more interest from other people, and so we are blowing this thing wide open right now, and we're not going to stop. And so it's awesome. Why isn't cannabis recommended to quit benzos or any other antipsychotics? It's effective everywhere. There's no way it doesn't override, some of the effery left by benzodiazepines. I mean, my feeling is that when you're coming off benzos, the best thing to do is just to taper the benzo slowly rather than going fast to the point where you have severe insomnia and anxiety and then you need the cannabis. I mean, cannabis has a whole host of its own problems with mental health, especially for like a psychosis and mania. Um, and but some people do use it for pain relief, for protracted withdrawal. I would just say, be careful, use it sparingly. It is something that can wear off over time. I mostly worry about high potency cannabis products, so please, be careful with what you're getting. Hey Anna, can Cymbalta make you lose memory? It can. So there are studies out there that show that some people, um, there's a higher rate of dementia diagnoses in folks on SSRIs. Do I think it's causing a neurodegenerative disorder? No, I don't. I don't think it's like an irreversible thing. But what I do find with a lot of chronic SSRI users is they develop a condition called tardive dysphoria, which is essentially just like a toxicity that happens because the brain is not designed to be on, essentially in a drugged state for decades at a time, or even years at a time. So people will experience things like brain fog and a lot of fatigue and apathy. And so I see a lot of that with chronic long-term use. And so if something like that happened to you, it may be the result of the Cymbalta. You can expect a natural healing. And lots of people have been where you are. I know it is terrifying if this is happening and you're feeling depersonalized. Your brain has a tremendous capacity to heal. Look after your body, eat good food, try and move, try and live the most normal life that you can, stay connected to others and community, and your brain will heal. That is by far the most common thing that I see with these withdrawal injuries. I'm so sorry that happened to you. Is it possible to incur permanent intestinal damage from mental health meds? I've been on over 10 mental health meds at once, med free for years now. Gosh, I'm so sorry this is happening to you. Um, really, it's not something that I commonly see as like a standalone symptom. Some people, when they come off meds and have protracted withdrawal injuries, they'll develop kind of irritable bowel syndrome type symptoms. They'll feel like really full or they feel really bloated. I have one patient that I'm working with now, and she's had it for about 3 years. It's gradually getting better. But it wasn't a standalone. I mean, she had it with a whole constellation of neurological problems, and they kind of gradually have just been going down over time. So it is possible. If it's just a standalone thing and it didn't happen with a whole constellation, maybe like in the setting of withdrawal, um, make sure you've got a great doctor and they can do a thorough evaluation. Thoughts on water fasting? Honestly, I don't think it's that harmful. Some people say it's really helpful. I think there's longevity benefits with water fasting. I don't. I'm not going to comment on this, but I think that's a great question for ChatGPT. Does water fasting change levels of psychiatric medication? See what it says. But I think a lot of people do it, and I haven't seen them having too many issues. I'm not going to say it's not safe. Your friends on Topamax, I would say the best way to do that. I think Topamax comes in very little tablets, And so find out what the smallest tablet is he can get it on, and they may be able to tape it down with just like quartering those tablets. If he gets to a point where he cannot progress anymore without bad withdrawal symptoms, ask his doctor to liquefy the Topamax and then kind of just work it down with a syringe from then on. Can I reduce or taper off SSRIs and mood stabilizers? 35 years. Okay, so this is a long period of time, been on and off different meds for years. So I'd say if this is mainly for like depression, and I would say, I think you can usually. For bipolar and schizophrenia, that's when it gets a little tricky. And the case reports that I've seen where people have been able to come off after many decades of use, it's usually once they've initiated a ketogenic diet. So severe mental illness, severe depression, schizophrenia, bipolar, if you're on antipsychotics, I think trying a ketogenic diet is a really good platform to build from. Steph has a friend who's having manic depressive episodes. She's off psych meds for some time and she's trying to go back on. Any advice? She seems like she's struggling. Okay. Yeah, this is obviously, really serious. And, I talk critically about a lot of medications here, but, in cases like this, we just need your friend to be safe. And so if getting on medications will allow her to stabilize and they've worked for her in the past, she can always come off later on. If you're looking at non-drug ways to help her, I mean, supervision is really important. If she's not doing well, just make sure that she's around people, and then ask her, what's going on? Is there social isolation? Is she having work problems? Is there problems with her diet and lifestyle and sleep? Try and support her in every non-drug way possible. But if meds are needed, then hey, that's okay. She can always come off later on if she needs to. I've heard it called Dopamax, Louise, because Topamax carries a really strong cognitive load. Okay, let's see what this one is. Tried to come off Seroquel and Effexor. The anxiety came back strong and I couldn't sleep. I don't want to be on these meds forever. How can I taper off of them? Okay, so Diana, I would recommend that you join my mailing list. Go to the taperclinic.com. I think you should be able to add your email there and get our free tapering guideline. In a nutshell, what you need to do is you need to look at the symptoms that you're having now and just be like, is venlafaxine or is Seroquel more problematic? Generally speaking, if all things are equal, maybe try come off. Well, you want to taper the drug. That's the biggest problem first. If you're struggling with oversedation, that's Seroquel. If you're feeling anxious and energized, that is going to be Effexor. So pick which one you're going to taper. If it's Effexor, you're going to do bead counting or get it liquefied into the instant release version. If it's Seroquel, usually you can taper down quite well with just the tablets because it comes in 25 milligrams. Just take your time, one drug at a time, drop by 5 to 10% every 2 to 4 weeks, and just kind of ease yourself off. But this isn't a joke. I would suggest getting a full-on education on drug tapering if you've struggled, and the free drug tapering training that we give out would be a great place to start. Yeah, big time. So Charmed, I would go on survivingantidependence.org and search, what do they call it over there? Histamine intolerance. heaps of people have histamine intolerance when they come off their antidepressants, and so that's really, really common. Yeah, yeah. Wellbutrin is not a great drug for anxiety. Wellbutrin is really stimulating. It's a great drug if you are like very flat. It's also one of the safer antidepressants. Mirtazapine will help you sleep and it will help you with anxiety, but it is a hard drug to come off. So if there's anything else that you can do for anxiety, I would recommend that you do that first. Journal, try and find out, where is the anxiety coming from? Can I find someone to help me with it? Are there things that I need to address in my life to fix it? Don't overlook moving your body every day and your diet. And so, again, it's no small decision to start taking a psychiatric med. And so, please see if you can find other ways to handle it if that's possible. Can you please talk about tapering someone who has akathisia? How do you determine the rate of the taper? So, Rachel, it depends where the akathisia is coming from, right? Some people will have akathisia, which is that kind of pacing because they've been usually they're put on an antipsychotic, and it develops very quickly. And so, if it's happened within the first couple weeks or maybe a month or so of starting a med or going up on a dose, you usually taper that quite quickly. However, other people often use the word akathisia when someone's had a severe protracted withdrawal injury. And so if you've been pulled off the medication too quickly and now your nervous system's kind of fried, um, that's kind of like a constant. And so in my practice, we usually just slowly taper those patients over time, even though they are highly symptomatic. As long as you're moving at that 5 to 10% rate, it generally is safe. Um, and I'm really sorry that you're experiencing akathisia. I think it's one of the worst side effects ever, and just hang in there. Hey, Christine, I'm using streaming software, so I can't see any super chats. I'll keep an eye out for your question. Just keep reposting it, okay? Let's see. What's the best way to taper off an antipsychotic, long-acting injectable? This will be my second time trying to taper. So, what I would recommend that you do is get over onto the oral version of the drug first, and then it will be much easier. So, if it's Risperdal injectable, Risperdal tabs. If it's Invega, you have to go over to Invega tabs and then to Risperdal tabs because the Invega ones have that capsule. But essentially, you just want to transition over to an oral form, and then that'll be a lot easier to taper. That's quite an advanced taper. I would also recommend joining our mailing list so we can share the free drug tapering training course, because there's quite a lot to learn to pull that off safely. This is how we make change. We have an aspiring pre-med. Nate, please become a doctor and carry this message about these medications forward, and tell as many people as you can. Some people tell me that, is this just a flash in the pan just because Secretary Kennedy and the Maha people are looking into this? I don't think it is. I think too many people have been ravaged by these medications. Too many moms have had kids hurt, spouses hurt. And I think we have so many people talking about it. I don't think this is ever going back. I really believe that this drugging away like symptoms and the overuse of the medications is, I think it's dying right now. And when we have pre-meds like Nate on the call, I feel really hopeful about all of these people going into medicine. Hey, Brandon, no worries. Happy to answer your questions. It's the I know the akathisia is really severe. Even just liquid drop reductions are causing outbursts. Have you ever seen hospitals help for severe cases? I have not. To my knowledge, there aren't any hospitals that that do this kind of work. I mean, it takes time. It is a really dark place. As I think, as long as you're going at that 5 to 10% rate and you're steady, just move. Do the drops when you can. If you need to take a break, that's okay. You don't need to be off the medications to heal. I've seen many people heal even on them, and so if you just need to take a break from that, that's totally okay as well. Do you think ashwagandha could be helpful for low cortisol? My doctor suggested it for short-term care with ongoing lab work. It's 200 milligrams daily. Anything I should be concerned about? I mean, the thing that I worry about with ashwagandha, Christine, is that it's one of those like nutraceuticals where it really does have a strong effect. I've taken ashwagandha before. It is very calming. It probably is safe. I know a lot of people take it and they take it every day. But I also think it has the potential to harm. And so low cortisol, we have to think about, why are you having low cortisol? Do you need help sleeping? That's a reason. Do you have high stress? Are you not getting enough fats in your diet? And so trying to go upstream and just be like, is there anything that I can do with, diet, exercise, sleep, reducing stress in my life? I would love it if we would be able to address it in that way before relying on a medication that could potentially cause harm. If you do need to take it, listen, there's things out there that are a lot more dangerous than ashwagandha, and so go into it slowly, see how you feel. But you may want to search ashwagandha syndrome online, just so you can be informed about the rare but serious side effect that it can cause. On Depakote, off-label for a misdiagnosed bipolar disorder, should I use the same taper method as for antidepressants? Yes. Yep. You totally can. That's totally okay. Do you think things like Visceral or other antihistamines would be a good substitute for anxiety rather than Visceral? They're much safer than benzodiazepines. I don't have anyone in my clinic with neurological damage from Visceral or antihistamines. And so if you cannot find another way to manage the anxiety, yes, they're a much better option. Do I have any opinions on mental health disorders being higher in Western countries? Yeah, I love these types of questions. Well, I do have some feelings about this. I think that we've had a complete loss of community in Western countries. I'll speak about the U.S. because that's where I am right now. I think religion was actually protective. I think religious values have been have given a lot of people direction and community, and I think we've lost that. I think we idolize things like material wealth and career success in the U.S., and I think often at the expense of family connections and communities. And when you have a whole bunch of people doing that, the world can become a very lonely place. We have a mental health care system that doesn't work in the U.S. And often misdirects people away from real causes. Our diagnostic system, if you're unhappy, you have a major depressive disorder, rather than like a genuine problem. And so I think our treatments really aren't that great. And I also think our society is actively pulling people away from good long-term values and actions that generally lead to people being happy, focusing on your family, your relationships, connection, living a life of service to others, all sorts of things. And so that's what I think is going on. Okay. Hey, Azul. What do I do if my meds aren't helping me with severe major depression? I'm maxed out on Lexapro, Wellbutrin. I've tried all these other meds, symptoms more or less the same for 17 years. So this is a really complicated issue, but I would start to ask the question, how long do you want to keep on trying different medications, adding different meds before you start to look for a different approach, which I know can seem really scary. And I'm not saying this flippantly, because I know how complicated mental health conditions can be, but I get a lot of patients in my practice who have really had the kitchen sink thrown at them, probably much worse than you. They're on 5 different meds. They've tried ECT, TMS, and all of that. Eventually, you have to get to a point where you start to wonder, are these meds harming me in some way? None of these drugs have been studied for over a year. Many people don't know that. The studies to get them onto the market ran for about 12 weeks. The studies that they use to determine whether long-term use is effective, they last about a year. And so if you've been on these meds for like 17 years, the truth is that no one really knows if they're safe and effective after about a year. And people don't say that. And so if you've tried multiple different things and they're not working, you might start to question the meds. Personally, when I see people on long-term SSRIs and different medications, they have brain fog, they have low energy, sometimes they have anxiety in the background that just doesn't go away. And it can be the drugs, or it can be that the drugs were masking like another issue that hasn't been addressed, whether it's a medical issue or a dietary issue. But yes, if it's not working, doing the same thing again and again and again can be insanity. And so I would ask that question and see where it takes you. But don't stop anything unless you talk to your doctor first or get some kind of guidance, because it's dangerous. Hey, let me know how that goes. Could you send me an email at info@taperclinic.com? It's really important. And so if that is something that helps, and if it is something that doesn't help you, I really want to hear about it, because we're kind of crowdsourcing solutions to a lot of these really bad injuries right now. Stay strong, man. Will a compounding pharmacy know how to safely taper? Hey, Doreen, no, they need very specific instructions, and usually doctors may not know how to send them. And so, again, if you go to my website and sign up for our newsletter, we send you our free drug tapering training, and it will show you how to educate your doctor on how to help you do the taper. How to heal protracted withdrawal on 10 years. So protracted withdrawal just gradually gets better over time. The majority of people will get better within a couple of years, substantially better, but it can go on longer. If you are saying that you still have this after 10 years, I'm so sorry that's happened, but that is uncommon. I do know some people where it's lasted that long, but the healing still happens. And so, um, good nutrition, get out, move, try and live as normal of a life as you can, and just and wait for the healing to happen. Can you reverse TD years after long-term psych med use? It seems to be getting worse as time goes on. Uh, Look deeper into that. TD is not something I usually expect to get worse, and so I would do a more thorough medical examination. Sometimes it can endure. I have seen it go away for some people, but it definitely can endure. And so again, trying to live um, the most normal life that you can while having this chronic condition is where I would place that emphasis, along with getting a really thorough medical evaluation to see why it's okay. All right, I'm going to sign off probably in about 10 minutes. And so if you have a question for me which I haven't answered, just spam it. I'm going to probably do maybe 3 or 4 more before I um okay. How safe is Latuda? There's a lot of side effects with Latuda. Go to Daily Meds, just search that in Google, and then that's where you get the most up to date drug labels. And then I would search Latuda in there. I actually think I've made a whole video going through the drug label for Latuda on my YouTube channel. So if you look at that, I'll go through the whole thing. But yes, Latuda has some serious side effects. So you can on these streams, and I'm going to plan on doing more of them, and I will announce when they're happening in advance. But for actual clinical care, we're only in the US. And if you need help, go to my YouTube channel and search how to find help for tapering. And we have a video where I go over all the major directories. Do we ever do charity cases? Not actually within the clinic, but this is something we talk about a lot. And we're going to try and do a lot more live streams, not just me, but also with the other professionals in the clinic, just so we can answer questions from good people all around the world. Nice username. Yeah. What's the reason that our menstrual cycle as women bring back all the symptoms like akathisia? It's been 3 years since I stopped the meds and I'm still struggling. Okay. Not that uncommon to be still struggling 3 years later. You will heal. There's nothing, I get these questions a lot of the time. It's been going on a long time. I have these symptoms. Is there something unusual about it that means that I'm going to be the different case? That's not true. Just hang on there. It will get better. Symptoms are always worse around the menstrual cycle because there's increased inflammation. That is commonly reported by many of my patients who are still of childbearing age. And so please don't be frightened when you have this flare up. I know it's very uncomfortable. That is normal, and it doesn't mean that things won't get better for you. Just hang in there. Yes, the answer is yes. All of the SSRIs and SNRIs can impact sex drive, sometimes in 70% of the people. It's quite a lot. Okay. All right, y'all. I'm gonna wrap up now. Thank you so much for tuning in. I'm gonna try and do this more and at a regular schedule. And thank you for all of the kind words and your support. Go out there and talk to people about the problems with these medications. You don't have to scare them. Just honestly, what's happening. And person by person, we are going to go around the world, and we're going to make sure that people have good informed consent about these medications. Okay. All right, y'all. Great to see you all. Take care.